My name is Dr Andrew Peregrine. I'm a clinical parasitologist at the Ontario Veterinary College, and it's currently May of 2017. I came to the Veterinary College here in Ontario 20 years ago in 1997, and at that time I asked my predecessor how much teaching was carried out on ticks that we find on dogs and cats, and I was told you really don't need to bother about that because ticks are not an issue. And they weren't back then, but in the subsequent 20 years things have changed dramatically in Ontario and elsewhere across Canada. And what I want to do today is give an update of some of the things that have been changing with respect to risk of ticks and the diseases that they can be associated with. So what I want to do firstly is talk about the ticks that you can find, particularly on people and our pets in Ontario, and also say something a little bit about the bugs that they transmit to our pets and ourselves. I then want to talk about the most important tick-borne disease in North America at the moment, and that's Lyme disease. What is it? What does it look like in pets and ourselves? I particularly want to address the question, is the risk of Lyme disease and exposure to ticks changing in Ontario and elsewhere in Canada? It's particularly important to understand the entire life cycle of the tick that's involved with Lyme disease, and especially its association with wildlife, to understand how things are likely to change in the future. And lastly, I want to finish by just making a few comments about what can be done both for ourselves and our pets to minimize the risk of tick exposure and development of Lyme disease. This picture here actually shows the ear of a dog that walked into a veterinary practice in Guelph. And the first question whenever you find anything on a pet is to ask yourself, what type of bug is it? This is a tick, and the question is, why is it a tick? Well, you can see 4 pairs of legs. And essentially, if you can see something on your pet or yourself with 4 pairs of legs, it has to be a tick. If you look carefully at this tick, it actually has hardly fed. It's not engorged yet. And that's very relevant when we start asking the question, well, it's a tick. Am I or my pet going to get Lyme disease? And I'll come back to that. So the first question is, what are the ticks that we actually will find on dogs or ourselves across North America? Well, if you look in the veterinary textbooks, this is the list of all the ticks, and there's a large number. However, in Ontario, there's essentially just 2 ticks that form at least 98–99% of all the ticks we find on our pets. And that's the American dog tick, whose scientific name is Dermacentor variabilis, and the deer tick, Ixodes scapularis. Why is it important to appreciate there are 2? Because only one of those is associated with transmission of the bug that causes Lyme disease. The other has no role. So it's extremely important when you find a tick to know which one you are dealing with. This picture, these 2 pictures here show 2 unfed ticks that could be found on ourselves or our pets, and they are the 2 ticks I've just mentioned. And the question you always ask is, well, which one is it? How do you differentiate them? Right behind the head is a large plate-like structure referred to as a scutum, and you need to ask yourself, is it multicolored or is it all dark brown? And if you look at the one on the left, I think you can appreciate the scutum, the plate, is multicolored. That's the American dog tick, Dermacentor variabilis, and it plays no role in transmission of the bug that causes Lyme disease. And in fact, in Ontario, we essentially think it's a clean tick. It doesn't transmit any pathogens, any bugs to people or our pets. That's not true further south in the US, but it appears to be the case here in Ontario. So what about the tick on the right? Well, if you look at the scutum on that tick, you can see it's all dark brown, it's got long mouth parts, and that's the black-legged or deer tick. The scientific name is Ixodes scapularis, and that's the tick that's the vector of the bug that causes Lyme disease. And the name of the bug that causes Lyme disease is Borrelia burgdorferi. It's a type of bacteria. Here's a picture of that bacteria. It's got a very characteristic appearance, and the disease it causes in infected dogs or infected people is referred to as Lyme disease. And it gets that name because it was first discovered in Lyme, Connecticut, on the northeastern seaboard of the US. And so it was found there many, many decades ago. In fact, it appears to be have been there a lot longer. So it's not a new infection or disease in North America, but it's certainly new, essentially, in Canada over the last 2 decades. So the picture I just showed you were 2 pictures of unfed ticks. The reality, particularly on our pets, is that we don't find ticks until they've been feeding for a significant amount of time. They have fur, so they typically are well fed by the time we find them. So I want to show you some pictures of ticks that are fully fed, and as I said, that's how you would normally find them on your pet. So here's a tick fully engorged on a dog. Actually, it's in Guelph in southern Ontario, and the question is, which tick is it? And just as the previous image I showed you, don't let the large body that's filled with blood throw you. Look at the plate or the scutum just behind the head, and I think you can appreciate that if you look at it, it's multicolored. It's light and dark brown, which means it's the American dog tick. Will my dog get Lyme disease? No, it's the wrong tick. Now, there's a few important things to appreciate about every tick's life cycle, and the reason we should understand this is because it helps us to realize where these ticks are likely to spread to in the coming years. The picture I just showed you of a fully engorged tick, that's a tick that's been feeding on blood. The tick's been doing that so that she can produce large numbers of eggs. Once she's fully fed, she typically will drop off into the environment and lay the eggs. And this picture on the right shows you a tick that's released hundreds, if not thousands, of eggs into the environment. If the environmental conditions are suitable, and that's typically outside, and reasonable amounts of vegetation and humidity, out of those eggs will hatch a larva. We almost never see these. They're tiny, and they typically feed on wildlife species. Once the larva has fed on blood, for instance on a rodent, once it's fully engorged, it drops off back into the environment where it molts. It molts into a nymphal stage. It's a little bit bigger. Those typically only feed on wildlife species. And once they're fully engorged with blood, they again drop off back into the environment where they molt into an immature adult. And it's usually the immature adults and fed adults is what we find on our pets or ourselves. So where do you find the larva, the first stage that hatches out of the egg for the American dog tick? You find it essentially on wild rodents. The nymphs you find typically on larger wildlife species, such as rabbits and raccoons. We do occasionally see them on dogs, cats, or people. And the adult Dermacentor variabilis, the American dog tick, typically is found on raccoons, coyotes, and those are the ones we typically find on ourselves or our pets. What type of environment is that tick best able to live in? Well, all the life cycle stages have got to live happily off the hosts they feed on, and the hosts need to be present. And typically it's open grassy meadows, young forests, along the trails where we often go hiking is where you'll find them. And typically we only find adults in the environment on ourselves or our pets in the spring and early summer. So that's the American dog tick. It's a great tick with respect to the fact it does not transmit the bug that causes Lyme disease. Here's another well-fed tick. The first question to ask is, does this look the same or different from the other tick I've just shown you? You can see it's fully engorged, but if you look at the plate behind the head, it's all dark brown. It is not multicolored, and it's got long mouth parts. This is the deer tick, the black-legged tick, or the scientific name Ixodes scapularis. This shows 2 pictures of the same tick unfed, and the picture on the right shows you the tick that's crawled up to the top of a blade of grass. You can see its front legs pointing out, all right, and what the tick is doing, it's called questing. It's waiting for you or your pets to walk past, and then the tick literally will just transfer onto you or your pets. Ticks do not hunt you. They wait for you to come to them. Why is this the tick that's of the greatest concern to the Public Health Agency of Canada? Well, it's because it transmits multiple things that infect people. But by far the most important thing it transmits is the bug that causes Lyme disease. That's the bacteria Borrelia burgdorferi. It does also transmit 2 other things that infect people. One is called Anaplasma phagocytophilum, and that also like Borrelia burgdorferi, infects our dogs. And there is a third parasite that's extremely rare in Ontario called Babesia microsi that does also infect people. Now on this slide you'll notice for the first two bugs, in brackets at the end I've indicated 4DX+, and that refers to a diagnostic test that's commonly carried out on dogs every year, primarily to screen them for heartworm. However, the same test allows us to screen dogs for exposure to both Borrelia burgdorferi, the cause of Lyme disease, and anaplasma that also infects dogs and people. And I'm going to come back to the data that we've obtained with that test a little bit later. So, how big are the different life cycle stages of the deer tick, Ixodes scapularis? Shown here first is a picture of a larva, and I think you would appreciate you essentially would never see it. It primarily lives in the environment and feeds on wildlife, but even if it occurred on us, I think we'd typically miss it. The nymphs are a little bit bigger. Again, they're very small. We rarely, if ever, find them on our pets. However, they are thought to be the primary stage associated with the transmission of the bug that causes Lyme disease to people. So it is significant with respect to Lyme disease risk in people. And it's the adults shown here that are yet to feed. These are the stages we typically find on ourselves and on our pets, typically fed for a short period, if at all, on people. However, they've often well fed by the time we find them in our pets. Now, this is the tick that's brand new to Ontario. And back in 1997, when I came to the Ontario Veterinary College, essentially at that point, the only place in all of Canada where this tick occurred was Long Point on Lake Erie. And since then, this tick is established in multiple places across Canada. The places where it is established are essentially areas where the life cycle shown here has been able to take place readily. Normally, the adult ticks feed preferentially, essentially, on white-tailed deer. They feed on the deer to get blood, but they don't get infected with the bug that causes Lyme disease when feeding on deer. But once the adults are fully fed, they drop off into the environment, and then they lay their eggs into the environment. And so this is not going to happen indoors. The tick needs to be outdoors to lay the eggs for them to remain viable, and then they hatch. And just like the other tick I mentioned, when they hatch, out of those eggs hatch larvae, tiny little structures that are in the environment, and they need to feed particularly on wild rodents to obtain a blood meal. Now, the interesting fact about this tick, if the mother is infected with the bug that causes Lyme disease, none of the offspring that hatch out of those eggs are born infected. So the obvious question is, so how do they get infected? And they get infected with the bug that causes Lyme disease when they feed on wild rodents, such as white-footed mice. How does that happen? Well, the bacteria that causes Lyme disease essentially circulates in the blood of wild rodents, typically doesn't make them sick, but when the larval stage of the tick feeds on the wild rodents, it takes in with the blood the bacteria, and once the tick's infected, essentially it remains infected for life. When the larva's fully fed, it drops off into the environment, molts, just as the other tick, into a nymphal stage, and quite extraordinarily, nymphs feed on exactly the same species as the larva. They feed on wild rodents. So if the larva didn't get infected with Borrelia burgdorferi, the cause of Lyme disease, the nymphs likely will. So it maximizes the chance of the tick getting infected, and once the tick gets infected, as I said before, it remains infected for life. So larvae and nymphs preferentially feed on wild rodents, and once the nymph is fully fed, it drops off again into the environment, molts into an immature adult, and that's what we usually find on ourselves or our pets. And for this life cycle to establish, you obviously need these wildlife species in the environment. You need vegetation and reasonable levels of humidity for the ticks to survive in the environment. So this slide just summarizes the hosts that we find larvae on, and it's particularly white-footed mice and other wild rodents. However, also shown on that list of species is birds, and I'll come back to that in a second. As far as nymphs, we primarily find them on wild rodents, but we also find them on birds. And for both larvae and nymphs, that's extremely important because we believe one of the primary drivers for the establishment of this tick in Ontario has been the migration of birds, particularly from the northeastern seaboard of the US in the spring up into Canada. Because when ground-dwelling birds take off in the spring, these ticks, larvae and nymphs, can be attached to the birds. They'll stay attached for many days. And when the bird takes off, the ticks go with them. And when the birds land, when they arrive in Canada, the ticks drop off into the environment. We primarily find adults on white-tailed deer, but you do find them occasionally on other wildlife species as well. Where is the perfect habitat for this particular species of tick? It's particularly found on long bush and grass on the edge of deciduous forests, and that seems to be a particularly good environment for finding this tick. What time of the year do we find the tick? Well, I mentioned for the other tick, the American dog tick, we find that in the spring and early summer, and that is also true for this tick. So in the spring, if you see ticks in the environment, it can be either of the two ticks I've mentioned, either the American dog tick or the deer tick. However, this tick is different, and that is you also will find it in the environment in the fall, in October, November, and early December. And the reality is actually it's in the fall that is when the immature adults first appear in the environment. So that's when we see them, typically late September, October, November, early December in southern Ontario. And if they have not fed, they then go dormant under the snow. And so then the adults we see in the environment in the spring, so that's typically April, May, June time, they are the ticks that survive the winter unfed, and now they're waiting to feed. So I think one of the obvious questions is, so what influences the risk of exposure to these ticks for you and your pets? Well, remember, as I said before, ticks do not hunt us. They wait for us to go into their environment. So if we don't go outside, if our pets don't go outside, there is no risk of exposure to the tick that's associated with Lyme disease. And this slide here shows you a number of images of a typical deciduous forest where these ticks can be found. They typically crawl up grass blades waiting for us to walk by. So the bottom left-hand image shows you a trail through the forest, and if you walked right along the center of that trail, you wouldn't get exposed to the tick. But as soon as you wander off into the long grass, that's where you're likely to get exposed to the tick. Now, I mentioned back in 1997, this tick had never before been seen in Canada outside Long Point on Lake Erie. However, following the mid-1990s, the tick was increasingly being detected in multiple places across Canada. And as a result of the concern from the Public Health Agency of Canada about the bugs it transmits to people and our pets, the Public Health Agency of Canada started a system that was called passive surveillance, and that is you, your veterinarians or your physicians could submit ticks to them, they would identify them and test them for the presence of particularly of the bug that causes Lyme disease, Borrelia burgdorferi. They've been kind to show me some of their data, and this is the map of Canada for 2008, where they received the deer ticks from, Ixodes scapularis. And you can see most of the ticks they've received at the lab in Winnipeg in Manitoba come from a few places, and that's right across southern Ontario, right up to the Quebec border, southern Quebec, in multiple places across the maritime provinces, and then in parts of southern Manitoba. Now, whenever you find ticks for the first time in an environment, Health Canada rightly says, well, make sure you know, is this what's called an adventitious tick? That's a tick that's recently fallen off a bird, or does it represent a population of actively breeding ticks? And the reason that's a relevant question is, if it's an adventitious tick, one that's recently fallen off a bird, it's very likely it doesn't represent an established population. So there's not long-term risk in that area. However, if it's part of an actively breeding population, there's going to be a risk of exposure there year by year, and the population is going to very likely expand its distribution. And so over the following 15 years or so, following the first appearance of this tick, the Public Health Agency of Canada funded a lot of work in Ontario and elsewhere in Canada to try and determine where this tick was actively breeding. And so this is the map for southern Ontario that indicated what are called the endemic sites where the ticks were actively breeding. There's a lot of money and a lot of work goes into proving these sites exist. You have to send people out to drag cloth across grass to look for the different life cycle stages of the tick. So you have to find all the different life cycle stages. You have to prove they're feeding on wildlife, and you have to prove the wildlife and the ticks are infected with the bug that causes Lyme disease. It's a lot of work, and that's what went into this particular map. But the problem with that map is, as soon as you publicize it, the date that the data was found, because it takes so long to prove that a site's endemic, by the time you've proven it, the map's out of date. And so very recently, I think a very sensible discussion has been taking place, and that is, how do you convey the risk of Lyme disease to physicians, vets, and the general public? How do you convey it to maps, using maps, trying to make sure they're as up to date as possible? Using endemic area risk maps is essentially always out of date. And so very recently, certainly here in Ontario, Public Health Ontario has switched to a mapping system that's referred to as that denotes Lyme disease risk areas. And a lot less funds have to go in to denoting a Lyme risk area. And this shows the June 2016 map for Southern Ontario from Public Health Ontario. Each of those yellow spheres on the map indicate an area where the folks in Public Health Ontario have gone out into the environment and have dragged for ticks. And they went out because members of the public, physicians or vets, submitted ticks to them from that area. They then went out, dragged for ticks in 2 seasons, tick seasons, and if they found them there in 2 tick seasons, that was concluded to be sufficient evidence that it was now a risk area. And they then put a 20-kilometer circle around where they found the tick to denote a reasonable risk area. It's important to note 20 years ago, essentially none of those areas existed. And so that's the establishment in 20 years. It was only on Long Point Lake Erie back in the mid-1990s. The area that's changed most dramatically is Eastern Ontario. However, there are multiple other places on the northern shores of Lake Erie and Lake Ontario, and many of those places represent places where birds land when they first migrate up from the US into Canada in the spring. They're the national parks. The ticks have dropped off there and they've established. How quickly things can change is actually shown here. This is a group of ticks that were pulled off a dog in Murphy's Point Provincial Park, which is roughly halfway between Kingston and Ottawa. 5 years before when this picture was taken, you couldn't find the tick in that park. This was taken in 2016, and there were essentially 30 ticks found on a dog in that park after only a 30-minute walk. They're engorged ticks. The ticks were found a few days later on the dog. So things can change particularly quickly, and things are changing quickest in Ontario, in Eastern Ontario. The climate and particularly the environment appears to be perfect for these ticks. So I think the obvious question is, to what extent actually is the risk of Lyme disease increasing in Ontario? Where are the changes greatest? I think it's particularly useful to first look at what's been happening in the US, because what happens in the US does drive a lot of the changes that we are seeing in Canada, and that's because of bird migration up here every spring. This map here shows you the Centers for Disease Control's map for Lyme disease cases in people in the US in 2001. And the next map, 2014, shows you a similar map for human cases of Lyme disease in the US in 2014. So the first map is 2001. The second map is 2014. And as you can see, in a 13-year period, there's been a dramatic increase in the number of cases of human Lyme disease, particularly in the northeastern seaboard of the US. And it's thought at least 70–80% of all the Lyme disease cases in people occur in that area. So it's states like New Jersey, New Hampshire, Connecticut, Cape Cod, Rhode Island, New York State now. And so that's the big hot spot. And remember, that's where many birds take off in the spring and migrate up into Canada, bringing ticks with them. There is another hot spot just to the west of the Great Lakes in Minnesota and Wisconsin. Just look at that area. That's 2001. 2014, there's been significant dispersal. Now, some of the increase in cases is almost certainly due to increased surveillance, but that doesn't appear to explain much of this increase. So what's been happening here in Ontario? Well, this is a table that shows all the ticks that the Public Health Agency of Canada received from veterinarians and physicians in Ontario between 2007 and 2013. And it indicates the number of the deer ticks found on cats, dogs, and people over that period. I think the important thing to appreciate is that at least 2/3 of the ticks they received came from people. Once the ticks were received, the Public Health Agency of Canada then examined the ticks to determine whether or not they were infected with the bug that causes Lyme disease. And so the first column here that reads Borrelia. That means the number of ticks that were found to be infected with Borrelia burgdorferi. The figure on the left is the number of ticks that were testing positive, but what's more relevant is the proportion or the percentage of the ticks that tested positive, and that's what's shown in brackets. Back in 2007, 7.5% of the ticks that were submitted to them from Ontario were infected with Borrelia burgdorferi. And over the following years, that increased dramatically up to 18.4% in 2003. So in a 7-year period, essentially the proportion of the ticks infected with the bug that causes Lyme disease in Ontario almost trebled. So now, probably at least 1 in 5 ticks on average across the province are infected with the bug that causes Lyme disease. What about anaplasma? This is another bug I mentioned in the same tick that infects dogs and people, and that stayed very low at less than 1%. And if you look on the right on the number of locations in Ontario where ticks were found to be infected with the bug that causes Lyme disease, it went up from 35 in 2007 to 163 locations in 2013. Things have been changing dramatically in parts of the province. Now, as far as the most significant take-home message is concerned then, with respect to you found a tick that is the deer tick, Ixodes scapularis, and you ask the question, what's the chance it's infected with the bug that causes Lyme disease? Overall in Ontario at the moment, as I just mentioned, it's just above 18%. And so on average, 1 in 5 ticks is infected with the bug that causes Lyme disease. If you travel across Canada, so for instance, if you go to Manitoba or the Maritime provinces, on average, it's about the same figure, just under 1 in 5 ticks appear to be infected. If you go to Point Pelee in Ontario, it's about a quarter of all the ticks, 27% of the ticks appear to be infected. And if you go to Long Point on Lake Erie, where the tick's been the longest, at least 60% of the ticks are infected in that location. So where you live and where you travel to, both in Canada and in the US, can change the risk of exposure to the tick and the bug that causes Lyme disease dramatically. Now, Public Health Agency Ontario is doing routine surveillance for this tick and testing the tick for the bug that causes Lyme disease regularly. And if you go to their website, you can find the most up-to-date information, as is shown on this particular map that's currently available on their website for 2015. Every dot shows you where they received ticks from, and the color of those dots indicates the proportion of the ticks that were infected. And so, for instance, in Prince Edward County, not only are there large numbers of ticks that were submitted, but many were infected. And so if you want the most up-to-date information on ticks that are being tested for the bug that causes Lyme disease, go onto the Public Health Ontario website. So there's clear evidence from ticks being submitted to Public Health Ontario and the Public Health Agency of Canada that things are changing dramatically, not only in Ontario, but also in southern Quebec, the Maritimes, and southern Manitoba. But what about our pets? Well, the reality is many of us are testing our dogs for exposure to the bug that causes Lyme disease every year. You may not know that. However, many dogs, especially in Ontario, are being screened every year for a test called the 4DX Plus test, and there are other similar ones. And the primary reason for using that is to test the dog for heartworm, which is an important thing to be doing. But this test and some other similar ones at the same time with the same blood sample allow your veterinarian to determine whether or not the dog has got exposed to the bug that causes Lyme disease and developed antibody. And so we actually have a lot of data for a lot of dogs in Ontario over many years. And these types of data are not available for people, but they are for dogs. So for instance, in Ontario back in 2007, we know that just over 68,500 dogs were examined with this test. A year later, in 2008, just under 57,000 dogs were examined. And then very recently, we've been able to get hold of the same data through colleagues at Oklahoma State University. They got hold of the same data for Ontario for 2013-2014, where just over 77,000 dogs were screened. So what was found? Well, I think it's particularly interesting. Back in 2007, just in excess of 0.5%, so that's less than 1% of the dogs in Ontario, had antibody in their blood. So very, very few had been exposed. And that's not surprising because this is a new infection and a new disease in Ontario. A year later, the figure had not changed. In fact, it was 0.47%. So that's 0.5% of all the dogs had antibody in their blood. But 5 years later, in 2013-2014, the proportion of the dogs that had antibody to the bug that causes Lyme disease had gone from about 0.5% up to about 2.3% in all of Ontario. And if you just look at Eastern Ontario, it had gone up to 5.1%. That's essentially that's a significant increase in the number of dogs that have got exposed to the bug that causes Lyme disease. Now the next map shows you where all the dogs that are positive were being found, and it's superimposed on the same map for the US. And it's important to appreciate the darker the blue, the greater the proportion of dogs that have got antibody, that have been exposed to the deer tick and transmission of the bug into them that causes the disease, Lyme disease. The very dark blue indicates in those areas more than 5% of dogs have been exposed. And where are those areas? Shouldn't surprise you. Right across southern Ontario, but especially eastern Ontario, especially southern Quebec, small pockets in the maritime provinces, and then a pocket in southern Manitoba. And you can see the counterpart areas that I've already described in the US. And so if you or your pet travel into those areas, all right, the risk of exposure to the tick and the bug that causes Lyme disease changes significantly. But do remember, if your dog's positive, you're typically in the same environment as your dog. And so if your dog's got exposed, it's quite likely you've got exposed. So what happens to your dog if it gets fed on by an infected tick? Well, the answer is usually nothing. And that is about 95% of dogs that get exposed never become sick. Only about 5% do. So most dogs seem to be resistant to the development of disease. They get infected, they develop antibody, but they don't become sick. If they do become sick, it happens many, many months after the tick bite. And it's usually 2 to 5 months after the tick's fed. And then the dog develops a shifting intermittent lameness. Often there's swellings of the joint. So one leg is lame for a few days, that disappears, and then another a leg becomes lame. So if you're ever suspicious your dog might have Lyme disease, take it into your veterinarian for an examination. But the important thing is not to panic if your dog tests positive with the test I've mentioned, because most dogs never become sick. The situation in people is very different. And so I think one of the obvious questions is, what's the evidence that the risk of infection in people in Ontario is changing? Now, fortunately, Lyme disease in people is a reportable disease in Ontario. And so the information has to be reported. A few important facts about the disease in people. It's very different from dogs. And that is, in a significant number of people, and it's usually somewhere between 60 and 80% of people that are fed on by infected ticks. So 60 to 80% of those people go on to develop a very large red skin rash at the site where the tick fed. All right, it's called erythema migrans, And by definition, it's more than 5 centimeters in diameter, and it develops typically 7 to 14 days after the tick feeds. So it's very, very different from a classic bug bite that occurs very quickly and is essentially never that size. And so if you're in a tick area or you're concerned and you've got a skin lesion like that, so a large red skin rash, more than 5 centimeters in diameter, go into your physician. That's the first clinical sign of Lyme disease. It occurs in at least 3/4 of people. After that, the bacteria spreads out of the skin elsewhere in the body, and for the first month, people will often develop flu-like signs. And in those early stages of infection, the infection can be very readily treated in people, as it can be in dogs. However, if it's not treated at that point, the bacteria can spread elsewhere in the body and can cause significant complications if it's not treated. So, how does the medical profession confirm Lyme disease? And these definitions can be found on the Public Health Ontario website. So there's 3 confirmed case definitions of Lyme disease in people. And if this occurs, these cases have to be reported by law. So the first confirmed case of Lyme disease is a person that walks into a physician who has this large red skin rash, so it's more than 5 centimeters in diameter, and that person's had a history of either living in or traveling into one of the Lyme disease risk areas. And so physicians today are encouraged to have the Lyme disease risk map that I've shown you, and as I mentioned, that can be found, the most current version can be found on Public Health Ontario's website. So the first confirmed case definition for Lyme disease in people, a large skin rash, and you have a history of living in or traveling into an area which is known to be a risk area. The second definition is you have clinical signs consistent with Lyme disease other than the skin rash. You go to your physician and they do some tests on you that prove the bacteria is in you. All right? And that has to be reported as a case of Lyme disease. And the third confirmed case definition is someone that has clinical signs consistent with Lyme disease other than the skin rash. They've done a diagnostic test that proves you have antibody. They've not looked specifically for the bug, but have shown antibody, so you've been exposed. And you have a history of living in or traveling into a risk area. And if you fit into any of those 3 categories, the physician needs to report that case because it's reportable. Now, the nice thing about the reportable system is that in addition to those 2 definitions, they also have 2 definitions that are referred to as probable cases. Because the obvious response when people hear those definitions is, well, what happens in areas where the tick is just established? So they're not on the map, they're not known to be Lyme disease risk areas. And so they've created 2 probable case definitions which are very similar to 2 of the first definitions of confirmed cases. The first one is exactly the same as the first one I told you about, and that is you go to your physician, you have a large red skin rash, more than 5 centimeters in diameter, all right, but you have no history of living in or traveling into what's known to be a risk area. That needs to be reported as a probable case, and that's great because it keeps us up to date with areas where things are changing, which we know is what's happening on a regular basis. The other probable case definition is people who have clinical signs consistent with Lyme disease, other than the skin rash. They found antibody to the bug in your blood, but you've not lived or traveled to a risk area. And that's referred to as a probable case as well. So these probable cases should pick up people that have got infected with the bug that causes Lyme disease in areas we didn't know the tick had established. And we know things are changing dramatically. For instance, in Eastern Ontario, the distribution of the tick is changing roughly 40 kilometers a year in some areas. And so this map indicates the number of reported cases of human Lyme disease in Ontario from 2002 to 2014. In 2009, the definition changed into confirmed and probable cases. That's why the green colours are different. But the total number each year is comparable throughout this whole period. And you can see there's been a dramatic increase in the number of human cases right from 2002 up to 2013. There was a drop in 2014, which was seen in the US, and it's thought that's was due to climate issues that year. Now, one of the very interesting things is what happens when you look at when these cases of Lyme disease are being diagnosed. And this map, this bar graph here, shows you by month throughout the year when the human cases are being diagnosed in Ontario. And you can see the vast majority of human cases of Lyme disease are diagnosed in June, July, August, and a little bit into September. And the important thing to appreciate, the clinical incubation period for people is typically about a month by the time they've gone into their physician. So it's typically much quicker than in dogs. So it's very likely these people are getting infected somewhere between May and August. So there's very much a peak in diagnosis of Lyme disease during the summer months in Ontario. So I think one of the obvious questions is, so what is driving the change in distribution? Why are things changing so quickly? Well, I've already mentioned bird migration in the spring is driving a lot of this. The birds migrate up and they bring ticks in. Now that's been happening for many, many decades, so why have things suddenly changed? Because bird migration's not. It appears that there's been an increase in tick numbers in the northeastern seaboard to a critical mass, and finally enough ticks have been coming in on the backs of birds in the spring to establish, and that's continuing. There also have been significant changes in the deer population numbers across much of Canada, white-tailed deer, and that's changing certainly the risk of ticks, because the more deer there are, the more hosts there are for ticks to feed on. One of the drivers for the changes in deer population has been reforestation. Planting trees has brought more deer in. But the other thing that's certainly been a driver is climate change. And if you look at the projected climate change across Canada from the year 2000 to 2080, as has been done in this map here by researchers at the Public Health Agency of Canada, I think it's a very useful look into the future as to where this tick is likely to establish. And on this map, the most important areas to look at are those that are red. The red indicates climate suitability that's essentially perfect for the tick. It doesn't mean the environment's perfect, but the climate is perfect. And you can see back in 2000, there were just a very few small areas, the Niagara Peninsula, parts of eastern Ontario, and a few pockets in southern Quebec, and that was it. In the next 20 years, so up to 2020, you can see there's a dramatic increase in climate suitability right across southern Ontario and parts of southern Quebec. If you then move on to 2050 and to 2080, there's a dramatic change in the distribution of Canada, both Ontario, Quebec, and the Maritimes. There's a dramatic increase predicted land area where the climate will become suitable for this tick. It doesn't mean the tick will establish everywhere. The climate and the environment needs to be suitable for that. Now, how realistic and accurate are these projections? Well, if you go back to the year 2020, the change in climate suitability in eastern Ontario almost exactly maps what we're seeing. And so because the environment's suitable for that, I think that's why we're seeing dramatic changes in tick distribution. There haven't been the same changes in the southern parts of the province. Whilst the climate's suitable, the environment isn't in many areas. Finally, I think one of the practical issues is when you pull off a tick, the question vets and physicians hear all the time is, am I or my pet going to get Lyme disease? And there's some important facts to appreciate and to ask yourself when you pull a tick off. The first question is it the right tick? And we've already gone over how to identify that. Is it the deer tick, Ixodes scapularis? The next question is, if it is the right tick, has it fed long enough to be able to transmit the bug that causes Lyme disease? All the data indicates is that this tick needs to have been attached and fed for an absolute minimum of 24 hours before it can transmit the bug that causes Lyme disease. So if it's not engorged or only slightly engorged, even if it's the right tick, there's no risk of Lyme disease. If it has fed long enough, it's fully engorged, what's the chance it's infected? Overall, the figure, as I mentioned earlier on for Ontario, is just under 20%. There's roughly a 1 in 5 chance. However, that proportion does change in certain hot pockets across Ontario. Remember, in Long Point, Lake Erie, a few years ago, 60% of the ticks were infected. So that's asking the question, is it the right tick? What's the chance my dog or myself have got exposed? What can we do when we go out into the environment to reduce or minimize the risk of Lyme disease in dogs or ourselves? As far as our dog's concerned, if there's ticks in the area where you go hiking with your dog, you should go to your veterinarian to talk to them about the most suitable type of tick control product you can use. And there are now a lot to choose from. There are topical products, so those are solutions you apply on the skin. There are products given orally to dogs, and there are also some collars. And so you should go to your veterinarian and talk to them about what's most suitable. Always, always, if you've got tick concerns for your dog, the first approach is to use a tick control product. The other option for dogs, and this is not available for people, is that there are a number of vaccines for Lyme disease in dogs. And the majority of people think they are of benefit for our dogs, particularly if you live or travel into high-risk areas. And so talk to your veterinarian to determine whether it's useful to vaccinate your dog in addition to using a tick product. The other extremely important thing, and this is just as important in people, all right, is to remember the fact the tick needs to attach and feed for a minimum of 24 hours before it can transmit the bug that causes Lyme disease. And so checking your dog and yourself and your family members every day for ticks is highly, highly beneficial. So what about people? Well, the reality is we don't have all the great control products for ticks that we do for dogs. So remember the times of the year when you're most likely to get exposed to ticks, and so that's in the spring and the fall. And if you're out in the woods at that time of the year, you can minimize risk of exposure to ticks by just keeping off bushy, long grass areas. But the reality is we often wander off into the bush. And so if you're going to be doing that, it makes sense to wear long pants, tuck them into your socks, and ideally wear long sleeve shirts. That means that if the tick attaches onto ourselves, it's going to be on our clothes. It then has to walk up our clothes until it can find an area of exposed skin. And we're much more likely to find the tick crawling up our clothes than under our clothes because we didn't tuck long pants into our socks. One other thing you can do to try and reduce the risk of the tick attaching to our legs when walking through the bush is spray DEET on our clothes and on our skin, and that acts as a repellent. It greatly reduces the risk of ticks establishing or transferring to our skin. However, the reality is sometimes ticks do make it onto our skin. They usually then crawl up our bodies to hot, humid areas. And the areas you're most likely to find ticks on yourselves are your groin, your armpits, and around the back of your hairline. And so those are the areas to check for ticks on a daily basis, and that's all the family members in addition to our pets. They're usually no bigger than about a poppy seed size when they're first on us, so they're not large. And if they're attached, ideally grab hold of the mouth parts right by the skin with tweezers and slowly pull out. Alternatively, if you don't want to do that, go to your physician, go to your public health people and ask them to do that for you. So the last question actually is a final exam question, just as we give the veterinary students here. Here's a picture of a tick pulled off a dog, and the question is, will my dog, or will I, if this is off me, get Lyme disease? So is it the right tick? Is it the deer tick? Well, the reality is, yes it is. Will my dog get Lyme disease? Absolutely not. This tick has not fed. So that's a great one to find. And it's more common we find them like that on people than our pets. What about this tick? Is this the right tick? Is it the deer tick? Absolutely. If you look at the plate or the scutum, it's all dark brown and there's long mouth parts. So it's the right tick. Has it fed long enough? Oh yes, it's very, very well fed. So if it's infected, it could have transmitted the bug that causes Lyme disease. And so if you ever see a tick like this, strongly encourage you to take it into your physician if it's off you, or take it into your veterinarian if it's off your pet, and they'll discuss the best management of that exposure with you. So I hope that talk was helpful. I hope it's indicated quite clearly there's been a dramatic change in the distribution of the tick that's associated with Lyme disease across much of southern Ontario and elsewhere in Ontario. Our risk of exposure to the tick and therefore Lyme disease depends on our lifestyle. If we never go outside, if our pets never go outside, it's not a risk. But if we do, we can get exposed to the tick, and if it feeds to the bug that can cause Lyme disease. There are many things that we can do with our pets and for ourselves when we're out hiking every day to minimize the chance of ticks attaching and feeding. And they're just simple practical tips. And for instance, if you go to Connecticut on the northeastern seaboard of the US, where they've been living with this tick and Lyme disease for a lot longer with us, it's become part of the daily routine to do tick checks on all family members and our pets. I think the important thing to appreciate about our dogs is they're typically very resistant to the bug that causes Lyme disease. Most pets that get exposed to the bug that causes Lyme disease don't become sick. In people, that's quite different. So I hope that was helpful. This last slide just acknowledges all the various people that have kindly contributed data that I've shown you. And so that's people in the Public Health Agency of Canada, colleagues at the Ontario Veterinary College, colleagues in the Public Health Agency, so Public Health Ontario, Oklahoma State University, and lastly colleagues at IDEXX Laboratories. Thanks very much for your time.